the pushy broad from the Bronx, New York. Follow her voice, a stray dog is nice. She's a pushy broad from the Bronx, oh yeah. Don't be surprised if you wanna listen twice. Make decisions, find the right choice. Know yourself better, find your own voice. It's okay if you need help today, cause everybody needs a little push. From the pushy broad from the Bronx, New York.
Welcome, Transformation Talk Network listeners. My name is Ellen Stewart, and I am the pushy broad from the Bronx. Welcome to my show, Recovery Recharged, where we share advice and support from experts in addiction and recovery and life. I am so thrilled to have this guest back with us today. This is the third time he's appearing on my show, and he always brings wonderful added insight to recovery and addiction. This particular topic is also very near and dear to my heart because it is part of the age group to which I am a part. This show is about the golden years, the hidden struggles with substance misuse among elders. And my guest today is Dr. Ming Wang. And for those of you who have seen and heard him before, Dr. Wang has a list of credentials that are a mile long. So I will just encapsulate them for you so that you understand that he is a real expert in this field. He oversees the detox and chronic pain programs and Caron's nursing staff, Caron Treatment Centers in Wernersville, Pennsylvania. He serves as a medical director for the Grandview and older adult programs. He's a faculty member at Caron, Reading Hospital Addiction Medicine Fellowship. He teaches the local and regional residents and medical students that rotate at Caron Treatment Centers. He is a diplomat of the American Board of Addiction Medicine, the American Board of Anesthesiology, and the American Board of Preventative Medicine Addiction Medicine Specialty. The Pushy Broad from the Bronx and Recovery Recharged is proud and honored to bring back to my show Dr. Ming Wang. Good morning, Doc. How are you?
Good morning, Ellen. Thank you again for inviting me back to your show. It's always a pleasure.
Thank you so much. Well, you are the expert in this, and I want to be able to really get to those people that are listening this morning because, number one, this is September, this is National Recovery Month, and this particular population is sometimes not quick to admit that they have serious problems. So tell me, what unique challenges do senior citizens face in relation to substance misuse?
Well, I'll tell you, Alan, Caron Treatment Center here in Pennsylvania, we've always cared for the older adult population. And in the United States, older adults are considered those 65 years old or older. We've always taken care of this population. However, a number of years ago, we recognized that this is a unique population that requires that has challenges that requires unique strategies to successfully treat. So since 2014, Caron Treatment Center have opened up a dedicated older adult program to help this population. And the reason why this population is rather unique, not just their age group, but also the comorbid medical conditions that oftentimes they come with as underlying medical conditions, heart disease, high blood pressure, things like that. And also just the demographics of this group, that they're older, different generation. They may relate better to folks folks of their own peers, their own generation, rather than within the treatment milieu of younger people in the 20s, 30s who are still working, have young children. And then also addressing some of the unique, what we call co-occurrences that's in this group, those life issues, whether it's medical, pain condition, mental health, that potentially could derail their sustainable recovery. And that's why we created this program here.
All right. So it is a separate program geared to older adults. Talk to me about what types of substances commonly come in when older adults. What do you see them using? How does it compare with the younger generation? What's the problem here for this age group?
In the United States, the older adult group, their substance of choice in the order of 1, 2, and 3. Number 1 is still alcohol, and followed closely number 2 and 3 by prescription opioids and sedative hypnotics. Sedative hypnotics includes things like Valium, Xanax, sleeping medicine like Ambien and Lunesta. In this population, aside from alcohol, which is legal in this country, if you're over 21 years old, the other 2 substances are prescription medications that are habit forming, the addictive medications. And once in a while, we do see illicit substances, marijuana and actual street opioids like heroin and fentanyl, but not very often, but mostly alcohol, prescription opioids, and sedative hypnotics.
So, what effect do these drugs have on the older adult population? What happens with their brains and their bodies when they come into you? What are you seeing?
All these mood-altering agents, including alcohol and prescription addictive substances, impacts the older adults much more than they would for younger population. And this is where the understanding of the human physiology and changes in physiology over time becomes very important. With older adults, many things change, right? We get older, and our organ systems, organs change, and especially the central nervous system, the brain and the spinal cord. And what happens with any substances, including alcohol and most of the prescription drugs, they readily cross over what's called the blood-brain barrier. Okay, this is a barrier surrounding our brain that prevents certain molecules from entering into the brain. So it's kind of like a force field. And this blood-brain barrier kind of deteriorates as we get older. And so mood-altering substances like alcohol and drugs, especially the fat-soluble drugs, crosses over this blood-brain barrier very easily. So in other words, Ellen, a little bit will cause a greater impact in older adults. When an older adult, if they used to drink 2 cocktails a night, for example, in their 30s, when they're 70 or 80 years old, those 2 cocktails will impact them much more so at an older age.
My goodness, that is really eye-opening, and I want everybody out there to be aware of this. It may not be you, you may not fall into this age category, but you have a parent or you have a partner or you have grandparents, and I want you to begin to take a look at how serious this is. In addition to the physical aspects of addiction, talk to me about what mental health issues you see when older adults come into treatment.
Most common mental health presentation that we see here are depression and anxiety. Okay, now depression and anxiety potentially could be underlying. That's something they've had for most of their life that was masked by their substances, masked by their alcohol, masked by their prescription medications. But when they're younger, they may function just fine. They're still working, raising a family. However, as they retire, get older, and their children move out because they're adults now, they're isolated. They lose a sense of purpose because they're not working and in their high functioning position anymore. And they could encounter depression and anxiety, and that becomes very, very evident. Now, the depression and anxiety could be secondary to their substance use, or it could just surface after their retirement and is compounded, made worse by their drinking and by their prescription medication use. Now, with these addictive medications, Ellen, we got to understand that when it's used regularly, daily, because of because of our body's ability to develop tolerance to these medications and to these substances, potentially an individual could begin experiencing withdrawal symptoms from these substances, even if they're still using it. Example would be if someone continuously drinks on a daily basis, and if they're only drinking, let's say, 1 pint of vodka on a daily basis, because of physiologic tolerance, their body would demand more than a pint after a while. And if they remain at 1 pint a day, they already could be going through withdrawal, even if they're drinking. And that withdrawal symptoms potentially could be the cause of the depression, the anxiety, the sleeplessness, the restlessness, the jittery feeling that they get. And so it's a dysphoric feeling, okay, rather than euphoric feeling.
I understand. So what older clients want to know, because there is an onset of fear that comes with going into treatment, with detoxing, how does your program and Caron provide safe detox? Because people are worried about, is this going to be painful? Am I going to be able to do this? What's the process when they come in?
If an older adult makes it through our doors, that's actually a huge endeavor. But Alan, before they even step through our doors, there's one challenge that faces the families and the loved ones, and that is even identifying that there's an issue. In this population, there's a challenge in even identifying addictive problem, because in older adults, many of the symptoms of substance use mimics aging. Okay, for example, with heavy drinking, for example, regular use of alcohol, people tend to have become more forgetful. They experience blackouts, and then it impacts the brain. Now their cognition is impaired, and they're stumbling around. They may lose their balance because they're intoxicated, fall, hurt themselves. And all these things could mimic an individual who is just aging. And oftentimes family will say, well, that's because mom is just getting older. She's becoming more forgetful. She is older. And so she's not as steady on her feet. So she stumbles and trips. And so it can mask potential underlying issues of alcohol use. And a lot of times our population, families are not aware of issues until an index event occurs, a sentinel event. That means that something bad happened.
Like what?
Such as a fall, they hurt themselves, they hit their head and need to go to the emergency room. And while in the emergency room, during the workup, the doctor finds out that their liver enzyme is elevated and they have high alcohol level in them. And now the suspicion of alcohol misuse comes to light. And the family's scrambling to determine what to do with their loved one. Okay, that's identification. The second challenge is referral to treatment. Oftentimes, the older adults, it is a challenge to convince them that they need help. And family often are unsuccessful in referring their older loved ones to treatment. Sometimes they need to enlist professional interventionists to help facilitate this process. And when successful, then they come through our doors. And the first order of business is always safety always comes first at Caron Treatment Centers. So if detox services are required, they'll start in our detox area where myself and some of my colleagues we are very familiar with changes in human physiology and pharmacodynamics and how drugs affect the older adult population. So that's always first order of business. And then they participate in treatment programming and any underlying medical issues that's kind of been ignored that needs stabilization, any chronic pain issues that needs to be addressed. We do that here and with multiple modalities. And then the last of the stages of successful treatment in older adults, Ellen, is that we don't just send our older adults home after they successfully complete treatment. and then wish them best of luck. Okay. We go through a very in-depth aftercare planning with the patient themselves and with their families and loved ones of appropriate next level of care.
All right. So it is very good to know that if you see a partner, a loved one, your parents, your grandparents that seem to be behaving in a way that concerns you, and you're seeing things that call red flags to this issue, please do not ignore it because your instincts are correct. Dr. Wang is talking about Caron, CARON.org. Call the admissions department. They will safely guide you to the older adult program. So, what do you do in addition to making sure that they're regulated? How do you begin to infuse a sense of purpose and a sense of belonging to these people to begin to make sure that there is no reoccurring pattern of feeling in a situation where they have no purpose?
Our experience here at Caron, Pennsylvania, is that this older adult population has a very high success rate in sustaining their abstinence. And the reason for that is that with our treatment here, we help the older adults identify with each other, their peers, and that they're not the only one going through this. They're not unique in what they're struggling with, and they could relate to others who are in their same shoes, and to instill that sense of purpose into helping them develop a different perception in their life at this stage, without work, without small children in the house, and help them shift their perception in that they do still have a purpose, in that they have children, they have grandchildren, they have great-grandchildren. Who needs them? They need their grandpa and their grandma. And when they're intoxicated and not emotionally and physically available, they have basically denied their grandchildren and their great-grandchildren of that. And also that they can't have good function and good quality of life for however much time they have left. And so we always remind our older adults that even at this stage of their life, that it's not too late to begin their recovery journey, and they can have a good quality of life, not just for themselves, but for their loved ones.
And that makes it so much better for families. I know so many people that I work with that have put their mother and father into treatment because they wouldn't allow that person near their young child for fear that something would happen on their watch, right? Driving while intoxicated or falling over, or even not good on their feet when holding a baby. So they're really missing out on a lot by not taking this into account and doing something about it, for sure. Right. So talk about what happens with the family. I'm sure you get a lot of family members that feel guilty. Oh my God, I put my mother in treatment. How do we handle that at Caron?
Yeah, it's not unusual to see family members, especially the adult children, who begin to assume responsibility for their older adult parents because oftentimes they need care because they're impaired on a daily basis. And these adult children are exhausted. And we're dealing with a few right now at our facility where adult children are just downright exhausted. And these adult children have their own family, they have their own children, they have their own career, and yet they have to care for their older adult parents who are impaired. And so we encourage the family and loved ones to care for themselves. And we, while their older adult parents are here, we are caring for them, and we collaborate with the adult children in appropriate placement for next level of care. And earlier I mentioned that aftercare planning, because if they return home, sometimes the home may not be the best recovery environment for them. They shouldn't go home. And if they go home, the whole cycle begins again. The older adult children will again have to assume responsibility. And again, that's exhausting for them. So here we try to help the family and the patients in determining what the most appropriate care is. Sometimes it's an independent living facility. Sometimes it's an assisted living facility. Sometimes it's in-home care, to take some responsibility away from the adult children so they could have a life themselves outside of caring for their older adult parents.
So your department also does a lot and helps with discharge planning so they are safe when they discharge. Tell me, please, how long the average length of stay is for this population?
Here at Caron Treatment Center, we encourage minimum 6-week stay here. And now the listeners might hear oftentimes rehab is 28 days, right? and that is there's no science behind the 28 days. But what we know here is that older adults need more time. It takes them slower to just land and acclimate to the treatment community. Sometimes it takes some time just for their cognition to clear up a little bit. And many of them come in a very physically debilitated state. And they're coming in a wheelchair, they're coming in with a walker, and it takes time to recondition them, strengthen them. And we have all the services available here at Caron, Pennsylvania to do so. We have physical therapy here, we have chronic pain group here, and chronic pain program, and heavy medical and nursing oversight. And the older adult unit is designed to accommodate not just older adult in age, but also anyone who have physical or cognitive challenges. And so with that, they do take more time.
So when they come in, they're on a slew of medications, obviously. You are helping them to detox safely from the mood-altering substances and from the substances that are addictive. What kinds of medications do you actually manage and not take them off when they come in?
It depends on what medications they're on and for what purpose. Oftentimes, the older adults, they're really not being compliant with taking their prescribed medications for their medical conditions like high blood pressure or diabetes, things like that. And so my role here, I serve a lot of times as a primary care provider to just manage their blood pressure, manage their sugar, manage their thyroid function and things like that. So if a medication that they came in with is not appropriate or not indicated, I will discontinue it. In other words, when they come here, they get the benefit of cleaning up their medication list, removing anything that's inappropriate or contraindicated that potentially could cause more harm than good. And so they do get a heavy medical oversight here.
So that's a full medical exam, a full physical, a blood panel, all of those things, correct?
That's right.
Yes. Okay. Well, you are absolutely a GP. So I know personally from bringing clients to this particular program how successful it is when people come out. So I am a living testimony that this particular program is unique. This particular program works. And it is really changing the lives of this population in a very large way. So talk to me a little bit about what you see. Give us some great success stories. Give me a couple of examples. We only have about a minute or so left. Give me the best of what you've seen.
One of the highlights here is a number of years ago, we had an 82-year-old male from the Philadelphia area who was under the care of what I believe was a very good physician from a major medical center in Philadelphia. After a while, he was going in and out of their emergency room so many times for unclear reasons. No one could ever find why he keeps ending up in the emergency room. And his physician at that institute, in collaboration with his adult daughter, decided that maybe take him to Caron And then here I discovered that he was on too much opioids, prescription oxycodone, and he was likely going through interdose withdrawal after so many years on it, and which led to dysphoria. And in older adults, they can't describe dysphoria. All they know is they don't feel well. And he had chronic pain issues. So he came here, I managed his withdrawal, put him on appropriate medications, gave him physical therapy, and he did not need wheelchair or walker. By the time he left here, he barely needed a cane. And he went home and he enjoyed the family, enjoyed the grandkids. And about a year and a half later, the daughter reached out to us and he had passed away from his heart condition. But the year and a half that he had back home was the best year and a half ever for a long, long time. The family thoroughly enjoyed him. The grandkids enjoyed him. So that's why we do this, Alan.
Absolutely. And I am so thrilled and I feel so great about recommending Caron. There are so many people that come from Caron that I use as consultants and collaborators on this show. Dr. Wang, it is always a pleasure to have you. If you have any questions about senior treatment in the substance arena, go to Caron, CARON.org. Thank you very much, and we'll see you next time. This is Ellen Stewart, the Pushy Broad from the Bronx, saying thanks for listening, and remember, everybody needs a little push.
From the Pushy Broad from the Bronx, New York.